Good afternoon. I'm Lisa Harrison. I'm an assistant professor in the physical therapy department here at UTC. And my passion is taking care of older adults. I'm a geriatric certified specialist. And in my clinical practice, which ended about 3 years ago when I joined UTC faculty, my colleagues and I saw this need for the ability to determine how well a person was functioning before they entered into our healthcare system. So, you ask me why? So it's the silver tsunami. So in 2011, when the baby boomers moved into the Medicare population, we saw an average of $4.5 billion being spent on physical therapy services. That's projected to go to $8.1 billion into 2030. And so there's going to be a huge need and a huge increase in cost. And as a movement specialist, our American Physical Therapy Association says that we should be transforming society and optimizing their movement to give them the best quality of life. So if you are let me tell you a little joke about a physician, an orthopedic physician. He had a patient walk into his office. He had a broken hand. At the end of the clinic visit, the patient said, "Hey doc, am I going to be able to play the piano after you fix my hand?" And the physician said, "Were you able to play the piano before?" So the whole process of figuring out how well a person is able to move starts with an interview. My student research group and I did a survey over the past 2 years, and we looked at what are we doing to ascertain this information. And we found that 85% of the clinicians that answered that survey were using interview techniques. And interview techniques are great, but we also found of those people that answered that survey that 50% of them are getting inaccurate information. They're finding out weeks into the therapy plan that this is not an accurate presentation, and they have to change that plan. So, is there a better way to measure this? Is there a better way for us to know how well a person moves and start off with a great treatment plan and maximize that $8.1 billion? In that needs survey, we asked participants, do you need something to help you assess this? And they said, absolutely. We're spending hours asking questions and we're still not getting accurate information. So they said, we need multiple areas looked into, and we chose the area of walking. So what is walking? When I ask a patient a question about what walking is, I'm thinking of that gentleman up there at the top. He's just walking away, and that's what I think walking is. But when that gentleman answers my question, he's really referring to that older fellow at the bottom. And so when you're developing a treatment plan, it's very different for the person at the bottom than the person at the top. So in that survey, we asked if we had a tool, what should it include? And the participants and physical therapists said falls, walking, levels of assistance, assistive device, other devices, and it needs to have a video component to it. We need to be able to see. We need to be able to show this to a patient and or caregiver and say, did you walk like this, or this, or this? So in order to develop that, we've mapped out what a video program, web app would look like. And there's about 188 video clips that would have to be pulled together and then processed and clipped where it could go into some sort of web-based program, and as many photographs as there are video clips. We also will need funding in order to look at design, coding, and integrated analytics inside of that app system. So I appeal to you and say, please support my charge to do a better job of finding out what our patients were able to do.